Hi, my name is Grace DeMarco, and I'm going to be talking to you today about infectious mononucleosis, or what is also commonly known as the kissing disease. So the Epstein-Barr virus is the most common infectious agent of mononucleosis. It is responsible for around 90% of all cases. It falls under the family herpes viridae. In that family, there are 7 other members, and I will only be focusing on one, the cytomegalovirus, because it is responsible for around 5 to 7% of all other cases of mononucleosis. Distinguishing between these two is important in diagnosing the disease. So here we're looking at the Epstein-Barr virus. It's also known as the human gamma herpes virus 4. You can see a linear double-stranded DNA core in the middle, surrounded by a nucleocapsid with a viral envelope and proteins around it. Okay, so from the time from when you're first infected with the disease until the time that you start showing signs and symptoms, that's the incubation period, and it is around 4 to 7 weeks for the Epstein-Barr virus. This virus remains dormant in your body for the rest of your life. When we talk about if mono is contagious or not, so yes, it is contagious. The virus can spread for up to 3 to 18 months after your symptoms reside. 3 months is the most common, but there's some research shown that the virus is spreading 18 months after your symptoms are residing. So also, since the virus remains dormant in your body for the rest of your life, it can resurface or reactivate, and when it does this, it can become contagious to others. But you will not get sick again if it does reactivate. So you cannot get mono more than once. It's remaining in your body for the rest of your life, but you will not show signs and symptoms of it more than once. Unless, very, very rarely, you're an immunocompromised patient, you can show symptoms, but that usually doesn't happen. Okay, so transmission. So it is also called the kissing disease. So saliva is the most common way of transport or transmission, along with other body fluids. It can also be transported through your blood, but that's not very common. And with organ transplants, this is also not common because it would be noted from the patient that is donating the organ. But if they had the Epstein-Barr virus in that organ and it is inserted to you, you could get infected with mononucleosis. Okay, so signs and symptoms of the disease. These can last from 2 to 4 weeks and up to 3 months. When we talk about 3 months, we're usually talking about signs of fatigue. And fatigue and swollen tonsils and lymph nodes and swollen spleens are going to be in the 2 to 4 week mark. Children under the age of 5 are usually asymptomatic. They become infected when they're young and they don't present any signs or symptoms, but then they become carriers for the disease. So later in life, if the virus reactivates or resurfaces, they can become contagious to spreading the disease to others, but they themselves will not become sick from it. Teenagers and young adults are the most common in this age group. And they also have the most severe symptoms. Okay, so there are 3 common rashes of mononucleosis. The first is a maculopapular rash. So this is shown with red spots and bumps. The rash may or may not itch, and it can be present anywhere on your body. This also does not have to occur with all mononucleosis cases. For palatal petechiae, this is just broken capillaries, and it is most common in the back of your mouth and throat for mononucleosis. And then the third is an antibiotic rash. So since mononucleosis, the Epstein-Barr virus is a virus, you do not treat it with antibiotics because those are used to treat bacterial infections. So if you are falsely diagnosed with mono, and a doctor prescribes you amoxicillin or ampicillin, it will react with the Epstein-Barr virus and cause this rash seen here. Okay, so if you look at these 2 pictures, do you think that it is caused by the same infection, only one is caused by mononucleosis, or neither are caused by that. You can see that they're very similar with white patches. There's some palatal petechiae shown and swollen tonsils with red ink. So actually, although these two pictures almost look identical, one is mononucleosis, a viral infection, and one is strep, which is a bacterial infection. So this shows you that physical signs of the disease are not sufficient enough in diagnosing if you have mono or strep, and laboratory tests must be done to further diagnosis so that you can be treated. Okay, so here's the diagnosis. The very first thing that the doctor will look at is evaluate your symptoms. So they will record the start of your symptoms and for how long they've been persisting, and looking at signs of infection. The next thing they'll do is probably a strep test, because a strep test will rule out a bacterial infection. So if it comes back positive, you know that you have strep and that you can put on antibiotics, but if it's negative, you'll do these other things that I'm about to explain. So the monospot test is the first test they'll run. This test is used first because results are usually given within a day, but it's not always accurate because it can't detect if you have mono within the first week that you are showing symptoms. So it could give you a false negative of the infection. This is also used because Epstein-Barr virus is heterophil positive, and this test is testing specifically the heterophil positive part. And the cytomegalophil virus is negative, heterophil negative. Also, this is not always accurate because if you have had EBV, if you were infected with it when you're young, it can show that you are having presence of the symptoms. Okay, and then the complete blood count tests your white blood cell levels, your red blood cell levels, and your platelets. So you usually just do the complete blood count, although you can do a white blood count test. But if your results are negative with the white blood count test, the doctor can look at red blood cells and your platelets to see what else is going on. And they want the white blood counts because they want to see if there's an increased level in lymphocytes or if there's any abnormal lymphocytes. The Epstein-Barr virus antibody test is a more specific version of the monospot test. So the results take longer with this test, but as opposed to the monospot test, you're going to get your results from that first week of infection to really see if it is mono or not. And yeah. Okay, so the CMV mononucleosis. So you can see in a picture here, the virus looks very similar to the Epstein-Barr virus. You still have your nucleocapsid and your linear double DNA core, and you also have proteins around. So this is different from Epstein-Barr virus, like I said, because this is heterophil negative. So that first test can tell you if you're dealing with a type of Epstein-Barr virus or a CMV. And then usually this virus in general is cause for other infections and not necessarily mononucleosis. So usually this virus is an asymptomatic virus, but if you're having symptoms, they're almost identical to the Epstein-Barr virus, but you are testing negative for Epstein-Barr, then you might have CMV-induced mononucleosis. Okay, so just distinguishing the two from each other. So usually in CMV mononucleosis, your fever and systemic symptoms are going to dominate in this case, as opposed to in the Epstein-Barr virus mononucleosis. And then, like I said, heterophil negative. Your adults are usually older in CMV than in EBV, and you're going to have a positive CMV IgM serology test. In your Epstein-Barr virus mononucleosis, you're going to have an enlarged spleen, which is more commonly seen in that than as opposed to in CMV mononucleosis, and that's why you won't always get an enlarged spleen, but if you have CMV, you might not. And then you also have more prominently enlarged tonsils. So when you look at this graph, when you have a mononucleosis-like illness, the first thing they're going to do is the monospot. When they're positive for EBV, you're most likely having mononucleosis. If you're negative, either if you have a large presence of lymphocytes, that's what you're looking for because that's when you know that you're infected with a type of mononucleosis. Then you'll do the EBV specific test. And like I said, when you're positive for that, you know that you have Epstein-Barr virus mononucleosis. If it comes back negative, but you have an increase in lymphocytes, you will do the CMV specific test. Once you do that, if it's positive, you will have CMV mononucleosis. Treatment. So there's no vaccine available. You cannot have antibiotics, and medication can be used to treat the symptoms. You also must avoid contact with all sports for at least 4 weeks because you have an enlarged spleen, which you can risk splenic rupture, which can be fatal.